So now that we have an opportunity to discuss the high-level architecture of the MyHealth Advanced Community Analytics platform, I'd like to give a brief demonstration of the Pentaho tool so that you can get an idea of what this would look like in practice, what it would actually look like to use the analytics platform. So I'm going to switch over to a web browser. The Pentaho tools are accessible over the internet through a web browser. No installation is necessary. All that's needed is a browser. So you can see I'm in a web browser here. I'm going to go ahead and go to full screen just to get maximal real estate. I'm going to go ahead and log in here. Like the Health Information Exchange, the Pentaho tools are highly secured so that individual users can only see data that they should have the right to see based on having access to that patient's data because they're providing care based on our privacy and security policies. So you see on the front screen I have different options here. The option I'm going to show you today is an analyzer report, and this would be what we referred to earlier as an organization's analytics sandbox. And so the first thing I'm prompted with is to choose a data source. Today I'm going to show you a diabetes management schema that we put together. And we had an organization in our community, the OU School of Community Medicine, that served as a prototype for our analytics tools. And the first place that they put the tools into practice was their Bedlam longitudinal clinic. The Bedlam L Clinic is a clinic in Tulsa that serves uninsured patients, and it is staffed by faculty and student teams, and the faculty members are leading third and fourth year medical students, and the patient population that's focused on again is the uninsured, but the specific focus of the Bedlam L Clinic is patients who are dealing with long-term diseases like diabetes or congestive heart failure, and they want to help the patients better manage those diseases, get on treatment plans that will help them and help them improve their quality of life, stay out of the hospital, and hopefully improve their health outcomes. So here as we look at the tool, we're going to be looking at the data for the Bedlam L Clinic that I just mentioned. Just a brief introduction to the real estate we see here. On the right you have the data elements that you can choose from. The data elements with the yellow dot next to them are what we refer to as dimensions, and the data elements with blue dots next to them are what we refer to as measures. You can see some of the yellow dots will be like the PCP name or the date of the result. We'll be looking at things like blood pressure, HbA1c, and LDL. All of those occurred on a certain date. We have various measures of blood pressure measures, HbA1c, LDL. Of course, we have patient information like their age range and gender and even their name. So to get started, all you have to do is to choose a data element, which I'm going to choose clinic, and you drag it on the screen and you drop it in. And so there we see our Bedlam L Clinic right here. So we're going to focus on them today. I'm going to right click and choose them and also say show me the care team associated with the Bedlam L Clinic. It allows you to drill down from that clinic level to the care team. And so now I'm seeing the care teams that are associated with the Bedlam L Clinic. I'm going to go ahead and remove Bedlam L Clinic from here, so I no longer need that. So now let's start looking at some metrics and see how each of these patient populations are doing in terms of their health outcome measures. So let's look at blood pressure. One of the focuses was getting blood pressure below 140/90. So this measure allows you to see for each care team what percent of their patients had a blood pressure of less than 140/90.